Hello, Dr. Rich Castellano here, award-winning double-board certified facial plastic surgeon, and I'm going to talk to you about what do you need to know for a consultation. So when we examine our face and ask the question, what is it that needs to be done, you got to think about the three areas we age. We sag, we lose volume, and we get sun damage to the skin, wrinkles, and sunspots, which depletes the collagen in our skin. All I ever do is I just put things back where they already were. If the skin sags, I lift it back up. If we lose the volume, I build it back up, and if we lose the collagen and get sun damage to our skin, we can build that back up. So how does that look when we look at our photos? If you have your photos in your 20s or 30s, you see how powerful it is to recognize the changes. So take a look here. For Diane, you can see how wide she is when we're young, and now she's more narrow and hollowed out. You see it's kind of like a ridge on the back of the jawline. That's because she's lost the bony volume there. Diane's been lifted and filled. It's not perfect, it's better, and we can continue to build on that. This is a very consistent trend. For Katie, she's a nurse, she's a figure skater. She took great care of her body, and in her own words, she said she couldn't do anything else for her face. So she's wide, now more narrow, jowling, lifted and filled. She's not back to where she started, but it's better. And it's these gradual changes that will make you look your best for your age, and if you want to look younger than that, you just have to act more immature. So wide, narrow, hollowed out, lifted and filled, okay? Even if we just do the fillers, Laura is a busy practice manager. We did some fillers for around her face. We also took the little mole off. It's a natural appearance, only one session, no downtime, no recovery. This gentleman came to our office. He was traveling the country. He read our book from Amazon and liked our philosophy. He came in, he did 2 sessions of the fillers. This is all in less than 30 days, okay? No recovery, no surgery, no downtime, very natural result, and he's happy. He had just a little bit of bruising. I've even done the fillers because I want to keep the volume in my face from when I was in my 20s. Hollow in through here, now he's more full. That's me. This is the 1440 Combo Light technology. We're very proud to offer this. This was not available when I was doing my training, okay? 1 day later, tightening up under the neck, there's still a little bit of swelling there, but you can see what a difference there is. There's no physical downtime with the 1440 Combo Light technology. It's a fiber optic that goes under the skin. You have a little bit of swelling. This is Monica. She's 8 months later. She did a little filler in the corners of the mouth and in the cheek. She came on TV with us to demonstrate her results. So there's no physical downtime, but socially you'll have maybe 4 to 7 days of swelling. So nothing replaces the ImageLift. While the laser energy treats the inelastic skin when it becomes inelastic here, like the old sock or the elastic band that gets stretched out and doesn't fit so well anymore, well, the laser energy can address that, but the lift tightens the muscle and removes the excess skin. So nothing beats the lift. And now I can combine these together. Pam got an amazing result with the lift plus the laser, treating all 3 strategies: inelasticity of the skin, loose sagging muscle with the lift, and removing that extra skin with the ImageLift. Judy did all 3 here. The laser ImageLift looks very nice. Deb got a great result, very proud of her. RJ is an actress. She's been on TV and been in movies, and I can't get that kind of improvement unless I'm combining the technologies with the ImageLift. What is your recovery? So there's physical versus social downtime. Physically, you're going to get back into your routine maybe in 1 to 3 days, depending on your health, but 1 to 3 days for most people. Some are more quick and some take longer. Socially, you'll pass the grocery store test at about 7 to 10 days. And these women from their 40s to their almost 80s, you can see in 1 week's time, look very presentable, okay? Heidi got a very nice result here. This is 6 days later. We trimmed a little bit of eyelid skin. We filled the hollows under the eyes, and she did the ImageLift. So 6 days later, she looks great. And here she is at 6 weeks. Looks very natural. 1 week later, at the ImageLift in upper eyes, 1 month, 1 week, and then she went on to do some of our marketing pictures here. 1 week after the image lift and upper eyes, and she's got the eyelid stitches are still in there. They're very difficult to see. 1 week result. Okay. Or we just trim a little bit of eyelid skin and we do some filler for the cheeks. The hollows we get at the tops of the cheeks, we fill those areas in. It looks very natural. Trimming a little bit of the eyelid skin and filling the hollows underneath. Under the eyes, really, it's the top of the cheek. Filling around the mouth, the tops of the cheeks and the upper eyelids. Trimming the eyelid skin. Looks natural for both women and for men. Okay. And really opened up her eyes, trimming the eyelid skin. Used to be we would take the eyelid skin, we would take skin, muscle, and fat for everyone, but no longer. You only take the skin when needed because it preserves as much tissue as possible, makes you look younger, and it's a more fuller look. You don't want to look excavated or skeletonized. Trimming the upper eyelid skin, natural for both men and women. Lower eyes, trimming the excess skin, trimming away the pockets, with a little incision underneath the eyelashes, look very natural. Fullness under the eyes, trim away the fatty pockets. Okay. Or we build up the cheek when there's hollows underneath. You can do this with fillers as well. So we're very proud to be a national center of excellence with our long-term fillers, and you're definitely going to get options here that you're not going to get in other places. Now, laser treatment. This is my Aunt Shirley. She's 76. She did the image lift plus the laser. I don't sugarcoat the laser. You need 7 to 10 days. You don't even want to see people, and the results are amazing. So if you want this kind of improvement in your skin, in the loss of collagen that shows up in these deep wrinkles, then you require the laser resurfacing. Nothing is going to get you that kind of improvement with the lip lines around the mouth. It does lighten the skin a little bit, and that is nice to lighten the skin because we get the sunspots and so forth. So we do our best to blend that in around the bottom of the jawline. You can see here the laser image lift, the external laser plus the image lift together gets a really nice result. So we will talk with you one-on-one about your individual goals. This is a brief overview, and we're looking forward to discussing your specific outcomes and what we can do for you.